Hello, welcome, and thank you for being part of this WorkSafe webinar from risk assessment to incident investigation, why consultation is so important. My name is Chris McKenzie. I'll be your host for today's session. And this morning, we will be following and exploring the following topics. What are the systems thinking incident review, also known as the STIR app, and a participative hazard identification and risk management toolkit, otherwise known as the APHIRM Toolkit, and how STIR and APHIRM can support worker consultation during risk assessment and incident investigation of a musculoskeletal injury. And to do just that, we're being joined by two experts. Stephanie Cassidy is the Chief Executive Officer and Certified Professional Ergonomist at Productivity Matters. Good morning, Stephanie.
Good morning, Chris, and good morning, everybody.
And Professor Sharon Newman is the Head of School, Psychology and Counselling at the Queensland University of Technology. Good morning, Sharon.
Hey, Chris. Thanks for having me.
Thank you both for joining us today. Now, we will be taking some of your audience questions a little bit later on in the webinar. So if you do have a question for Stephanie or Sharon that pops up as we're chatting through some of today's topics, feel free to pop it in the chat box so it's ready to go as we get to your questions a little bit later on. But let's start by taking a look at Stephanie's project to identify hazardous manual tasks within food services departments in a large sample of Victorian public healthcare agencies. Steph, can you provide us a bit of an overview of this project?
Certainly can, Chris, and everyone. The project involved 8 Victorian health network providers, and we were using the APHIRM Toolkit. So don't forget the acronym is APHIRM, if you need to know that, to identify hazardous manual tasks and psychosocial hazards likely to impact musculoskeletal outcomes in food services areas. And so our intended outcomes with the particular project were really to find out what psychosocial hazards and physical hazards exist, use a participative approach to identify risk and or controls that might reduce that risk, to really reduce musculoskeletal risk overall. We certainly also have an intended outcome to do some risk assessing within the work environments and develop an app as a result of the particular application of the toolkit. It was interesting that we did find some very similar hazards within each of the food services departments at the health network providers. And it's no surprises. There's repeated sustained or high forces that they're using, for example, in pushing and pulling a heavily laden meals trolley, or opening a freezer door, or lifting bags of new produce in stores. They definitely sustain a lot of awkward postures, for example, reaching for condiments when loading up meal trays to be delivered to patient rooms, and repetitive movements like stripping down meal trays after completion of eating in the dishwasher rooms. So there were certainly very similar practices and hazards identified across each of the food services departments.
Thanks, Stephanie. And what type of injury risks were identified in finding those types of issues?
We actually wanted to gather some statistics on the injuries at the outset of this project, and we did that via, there's a common program across the food services departments that we use to identify the different areas of injury that were occurring in these environments. And we know from that data that there have obviously been incidents that involve sprains and strains. That's their most common injury. And that included repetitive tasks, awkward postures, and high force. So exactly what we were thinking we found. The injury types are predominantly sprains and strains or soft tissue, and they're to back, shoulders, and arms. So they were the particular areas of the body that we were interested in. And most workers who do have an injury in the food services department we found did recover. So we were looking at whether or not they recovered with treatment intervention, which they did. But some of them actually result in long-term chronic conditions. And we know also by looking at the data across injury statistics that the workforce in food services, in all of them, are ageing. And that actually brings its own inherent risk as well.
Thanks, Steph. Some good insights there. And we're going to come back to the APHIRM Toolkit in just a moment. But we might come across to you now, Sharon. Once an incident has occurred, we obviously need to identify the ways in which the problem occurred. Can you explain how the STIR app approach helps with this?
Yes, definitely. So in safety science, accident causation models are a way of understanding why accidents happen. Models come in various forms, but they all aim to explain causes of accidents and determine what or who is to blame. Models are incredibly valuable because we can figure out why accidents occur. We can work towards preventing them from happening again in the future. This is all about understanding the causes and taking measures to avoid similar incidents in the future.
Great, thanks, Sharon. Could you take us through the different models?
Yes, definitely. So the first is a simple linear sequence of events model. This shows accidents as a straightforward chain of events, focusing on isolated failures and individual human errors. The second is complex linear models. So these take into account a more intricate web of factors and interactions that contribute to accidents, going beyond individual actions and exploring the broader context. The third is complex nonlinear systemic models. These recognize accidents as complex systems involving multiple interconnected elements, where causation is not always linear or predictable. Progression of these models signifies a shift in focus from narrow perspectives to more comprehensive understanding of accidents within broader work systems. It is important to note that many organisations still rely on outdated investigation tools based on older models, such as the simple linear model. Models you pick affect the data you collect, how you analyse it, and most importantly, the recommendations you make.
So, Sharon, the STIR app has a system thinking approach. Tell us from a user's perspective how that process works.
Yes. So STIR is underpinned by systems thinking, accident causation model and method, Rasmussen's risk management framework, and the associated AXIMAP technique, which is short for accident map. So the app provides standardized method for investigating injuries and generating actions to prevent future injuries sustained through patient handling. So the app is designed to map out the flow of events, as you'll see at the bottom of the screen in the graphic, and understand how these events unfolded. This process helps to identify right people to talk to within the workplace and beyond, such as regulators and government bodies. And this is to fully understand the incident under investigation.
And Sharon, I understand it also provides some useful prompts. What do they look like?
Yeah, so you'll see in the figure in the top right-hand side of the graphic that there are prompts targeting those key stakeholders to interview, which can be done automatically through the system so that they can help identify the contributing factors and the relationships between the factors. Other prompts assist practitioners in identifying the factors contributing to an injury across all levels of the system, not only factors occurring at the areas of frontline staff or equipment failure. Integrated within the app is the AXIMAP tool. This allows users to create a map of the incident under review, as well as highlight key issues and areas that require attention. This is the color coding scheme that you can see in the graphic. The app guides practitioners in generating actions that have the capability to create systemic change in the healthcare and social assistance industry. The end user is encouraged to generate actions at addressing the issues identified in the AXIMAP and ensuring these actions are feasible and practicable for implementation to prevent similar incidents happening in the future. The app also features a dashboard, and this dashboard summarizes the stage of incidents under review and provides an overview of actions and their completion status.
Sharon, where can the STIR app be found, and what are the systems needed to operate the app within an organisation?
So the location of the app is shared on the bottom of the screen that you see here. In terms of users, an organisation's health and safety representative can register for an organisational account. When registering for this account, the user will be asked to provide details such as details on the organisation, such as name, address, phone number, website, and details about the account holder, including the occupational health and safety practitioner's name, address, work address, and phone number. Once the organisation has been approved, additional users can be added within the organisation. Given you'll be providing some organisational data, it is important that you receive approval from leadership to create an account. You can be reassured that everything is confidential and any data that is put into the STIR can only be accessed by users within your organisation who have been given access clearance by the lead organisational user. The STIR app prioritises security at every level to protect user data, maintain system integrity, and ensure a secure user experience through the use of file-based authentication, email multi-factor authentication, and data encryption.
Thanks, Sharon. That's a great overview of the STIR app there. Stephanie, we might come back to you now. The APHIRM Toolkit, as we mentioned earlier, has been utilised within the project you lead. Could you explain to us how the app has assisted in the collection of data and the consultation required to bring this work together?
Absolutely. Look, there's a lot of influencing management which is required at the outset of the use of the APHIRM Toolkit. It's having executive sponsorship and operations management support to implement the APHIRM Toolkit is really the key to its success. It is a fairly resource-intensive approach, and with their support, obviously at that level, you can actually then implement the APHIRM Toolkit to success. Obviously, in communicating, not only from a senior management level, there has to be communicated intent to the project, to the workforce. They need to be involved in the project, understand what they're trying to achieve by completing sort of various parts of the project. And they need to, you probably need to be fairly careful about considering the level of understanding of the workforce involved in the project in the way in which you communicate the intent to them. Obviously, the APHIRM Toolkit uses a survey approach in both identifying physical and psychosocial hazards, which I don't think I mentioned psychosocial hazards previously too much. And in this particular project, we did decide to assess for both, so have a look at whether or not there were psychosocial and physical hazards present in the workplace. And obviously, the surveying had to be done. It's done with the use of the toolkit, which is available on their web-based tool, and you can use a QR code and a worker's phone to actually collect data. Some organisations don't have a tech-savvy workforce. In this particular case and this project, some health network providers decided to do a paper-based collection of surveys and then had to enter the data into the toolkit themselves afterwards, so very resource-intensive. But secondly, some of them decided to actually just sit down and have a workshop with people and ask them the questions and collate the questions in person, because they didn't have either access to tech or capability to use tech and QR codes to answer the survey. And once you've done the surveying, it actually then produces a really neat one-pager of the top 10 surveys that are relevant to that workplace. The product of that really is that you will have a nice sort of very brief description of some of the hazards that are present. And the toolkit then allows you to actually send those hazards out to the initial workforce that you surveyed, and they can then provide feedback or suggestions on some of the hazards that were present. And that's a valuable tool to take then into what we call the risk management teams. So risk management teams are then set up where we use both the information that's been identified of hazards and the feedback provided by people that have completed the feedback. And we start to identify, this is the participative approach, with workforce-led participative approach, we start to identify suggested risk controls. So how could we do this differently? How could we do this better? How could we do it so it doesn't cause you harm? How could we do it so it makes you more comfortable? How could we do it so it's more productive? So they come up with amazing ideas, and that's probably the most exciting part of the project. And then we can actually start implementing those ideas with the support of operations and or the executive sponsorship that's come along with at the onset of the project. So really, it probably does need to have keen supervisor support. As you could appreciate, sometimes the psychosocial hazards identified might be things like poor leadership or poor supervisor support. The APHIRM Toolkit allows you to hide some of that information in the risk management teams that you develop and that you facilitate, so that there's, and you can address that particular hazard perhaps directly elsewhere outside of that particular risk management team, because it might be an uncomfortable hazard to discuss in front of a manager and its team members, for example. So yeah, that's how the data is collected. And then obviously we go into a risk management approach and talk about the data and how we might actually suggest risk controls that reduce, harm to people.
And Steph, how easy is the toolkit to use? And is it something that you might need training for?
Yes, definitely. I would definitely suggest training. It's well set up. It's quite intuitive. It's got a lot of resources available on the website itself. So there's a lot of how-to sort of work instructions. The key, though, I think, is in doing the training is that you start to understand how the toolkit pulls together the hazards. It uses an algorithm. And so if you have chosen work groups or data sample sizes that are probably a little bit small, it might actually impact the hazards that the APHIRM Toolkit produces for you to then work on. So I do think it's very valuable if you do the training. We've made a few boo-boos along the way in terms of the way we've applied it in this particular project. And so it would be valuable if you just think, yes, I want to take this APHIRM Toolkit to my workplace, do the training through La Trobe University. It's valuable to do it.
And Steph, in your experience, what types of organisations should be considering the APHIRM Toolkit?
Look, I think any medium to large organisation that has a problem with hazardous manual tasks and or psychosocial hazards that they think might be impacting on musculoskeletal outcomes. And that's something I probably didn't mention at the start, Chris, is there's a real, there's a direct connect from the La Trobe research that's been done over the last 20 years. It's been led by Dr. Jodie Oakman. There's a direct connection between how stressed out we are as individuals, so the psychosocial impact that those hazards have on us, and musculoskeletal outcomes. So the more tense, the more anxious, the more sort of those sort of things we're dealing with in the workplace, it will have an impact on your body physically. And so certainly it's, researched, very well researched, and there's a direct link between the two. And if that's something that you're keen to explore, both psychosocial hazards and physical hazards at the same time, it's a great toolkit that you can you can do that with, and it's evidence-based.
Fantastic. Thank you, Stephanie. And Sharon, both of these apps sound super helpful. Sharon, how can people sign up?
Yes, so you can sign up through the link on the bottom of the screen, as well as through the WorkSafe webpage. There is no cost involved in signing up to the STIR app. As mentioned by Steph, I highly recommend training for use of the STIR app as well. We also have a training session coming up on December the 3rd. This training session is free and can also be found on the WorkSafe STIR page.
Fantastic. Thank you, Sharon. And Steph, what about the APHIRM Toolkit?
Same thing goes. It's a free toolkit, so that's very valuable to a lot of organisations when they don't have to sign up and pay for something that's evidence-based and works well in most organisations. It can be found at APHIRM, so APHIRM.org.au. And obviously there's some training that is being supported by WorkSafe Victoria, and you can register for these sessions via the WorkSafe events website or via the URL provided. And again, I'd encourage businesses to give it a go and see if it's right for your organisation.
Perfect. Thank you, Stephanie. I think it is time to take some of your questions from the audience now. There are plenty coming through, but if you do have a question for Sharon or Steph, you feel free to pop it into the chat box so we can get to it. And someone has very helpfully put a link to the training for the APHIRM Toolkit in the chat there as well. So if you're looking for that link, you can grab it from there. As both of you did mention, both apps are free to use, but Steph, are there any features that need to be unlocked if with a payment on either of these apps?
No, it's all just there. You can just log in and set up an account and start using it. It is again, the data is owned by La Trobe Uni, So it's really valuable for that to use the toolkit as a valuable resource for them to continue their research as well. You can talk to them about how that data is protected. So it's certainly worth doing that if your organisation has concerns about that. That's probably the biggest question we get from organisations is how is my data going to be used? So I would direct you to La Trobe. They've got, you know, that they can reassure you that that's just, you know, it's very private. But yeah, it's as easy as just signing up and giving it, having a look and giving it a go.
Sharon, the same with the STIR app. I think some people might be burned by getting on the App Store and downloading their favourite app and then having to pay for some extra features.
Definitely the same. It is a free app. So I go onto the website, you log in and you create an account, and exactly the same as what Steph was saying. We have gone through a long process of ensuring that the data is confidential, that there are all the security measures in place, and the data does get used for research purposes, but from an aggregate level. So no individual data would be used in any reporting that comes from use of the app.
Excellent. Sharon, I might stay with you. We've got a question coming through in relation to the STIR app, asking, does the STIR app prompt senior management and leaders to engage with the health and safety of an organisation, or do you need to inform them outside of the app? Is there something inclusive there for leaders in an organisation?
Yes, so within the app itself, you can request that senior managers, and even regulators engage in a section of the app. For example, if you wanted to get some information regarding particular controls in place or perceptions of the failure in the risks, that you would be emailing them directly through the system itself and getting that contribution, and that the history of that conversation is saved within the app as well. And then it can be used directly to populate the AXI map in terms of the risk factors, the relationship between risk factors. Just reiterating what Steph said, it is resource intensive, and that's because it uses a systems thinking approach, which essentially means that we ask questions above and beyond the traditional approaches to incident investigation. So there's more depth in the investigation. With this, it does need that commitment from management and senior management for staff to engage in the process. So it is not a silver bullet solution in any way. It is resource intensive, but the value of the data is so much stronger than in traditional approaches to data and investigation.
That makes sense. Thank you, Sharon. Steph, question coming through for you now, asking, have staff found the surveys from APHIRM easy to use?
Yep, they have. So it was, and again, we had to modify our approach based on some groups. But yes, look, it's been a process that they all found it relatively easy to understand. There were a couple of words in some of the questions that we had to provide clarification to some of the users on. It was just mainly, I think, because we had a large proportion of the people from food services departments where English may not have been their primary language. And so we definitely had to sort of assist people who, you know, there was some, you know, just some words that they had difficulties with. Otherwise, it was really easy to use. The QR code was by far the easiest application of the survey. They could just do it whenever.
Thanks, Steph. I might stick with you. A similar question. You did mention earlier there were a few boo-boos, a few things that had to be changed. The question is, what were the boo-boos, and what would you do differently if you had your time again?
Yes, it's about selecting. So, for example, we had one hospital who had 4 different kitchens. And we decided to sample to survey them in separate kitchen pools. What that meant is that some kitchens had less than 12 staff. And so they were only small sort of plating kitchens, for example, versus a larger production kitchen. And the sample size was too small to get valid data for that group. So their hazards looked a bit weird when they were produced, and that's because the algorithm in the APHIRM toolkit didn't work well. So that was our boo-boo. We probably should have actually aggregated some of the kitchens together and then done risk management teams perhaps separately, or even brought them together if we could. Locations were a problem with that. So we had kitchens that were dispersed, and workers that were dispersed. So to bring them together in a risk management team from, one kitchen to another was going to be difficult, because they'd have to travel between those locations, because they weren't that familiar with the use of virtual, like meetings. So they're the sort of, little nuances that came through as we, went through the project. So yeah, I definitely have a very hard think about how you set up which pools of people would be doing which surveys together to get data that's probably a little bit less arduous and unusual.
Thanks, Steph. Sharon, we did talk a little bit earlier about the data in the STIR app and where that goes and who can have access to it. There is a question here about, does the regulator, WorkSafe, have access to the data submitted in the app? And does WorkSafe use it against organisations if notifiable incidents have not been reported, either deliberately or otherwise?
Absolutely not, no. So the data is hosted by Queensland University Technology, and only the researchers at QUT have access to the data. Aggregate reports be made available to WorkSafe to report on the evaluation of the trial of the app, but no individual data will be made available, and they cannot access the system.
Thanks, Sharon. And just another one here on the STIR app. Is the STIR app online through the web browser, or is it there's some particular software that needs to be downloaded and integrated onto each computer in an organisation?
No particular software is required. So you can go onto a web browser and type in the address, and then it'll lead you to the STIR app webpage, the login, and then it'll give you prompts from there in terms of getting access to the app itself.
Excellent. Thanks, Sharon. I think a good question for both of you has come through, asking if you have any suggestions for encouraging an organisation to implement these apps. Are there any resources to assist in that process? Steph, we might start with you there.
Yeah, absolutely. In the APHIRM Toolkit, there's actually a resources page that talks about how you can influence the implementation or the introduction of the app to senior management. So they've got a full presentation to senior leaders on what outcomes they can expect, what time it will take, who should be involved. So that there's like a plethora of information available, actually, that you can just fine tune it to speak to your organisation's language, but it's all there. So you don't have to kind of, a lot of our guys were going, I'm really struggling. And I go, oh, let's have a look at the resources on the toolkit. And there you go, oh, there's a nice presentation. Let's use that. Let's modify it a bit, put in some outcomes that we're expecting, etc. So it's all there. Like it's very, in the resources tabs on each of the sections as you go through the process, there's more and more information that will help guide you through each step.
Sharon, have you got any thoughts on that?
Yes, definitely. So within the app, there is a tab where you can look at the resources as well. So we have focused on making sure that the app is going to be user-friendly and is well evidence-based as well. So you will be able to look at the various research publications in the app itself, but more so there are animated videos that will guide you through each step of the app. So it'll give you the guidance on how to use the app, and it'll give you examples of the full cases that have been undertaken using the systems thinking approach to incident investigation. Saying this, I do encourage everyone to attend the training, because the training provides that more in-depth approach to understanding the app and use of the app. But the resource tab within the program itself will provide you a good level of knowledge in terms of how to use the app and why it is important to use a systems thinking approach to incident investigation.
Great. Thank you, Sharon. Stephanie, we've obviously been speaking about some health services with your project today, but a question coming through, is this an app that can be used in any industry? Any
industry. So I've used it in 2 other applications. One was with, and it will be no secret who it is, but it was blood collection services in Australia, and also in mining. So we've used it, mining, we're particularly interested in using it from a psychosocial perspective. whilst focusing both on the physical and psychosocial, they felt like that was an easier entry in identifying psychosocial hazards within their very male-dominated work environment. And so it was a toolkit that we suggested, and they said, yeah, let's give it a go. And it was easily applied, as easily as any other industry.
And Sharon, what about the STIR app? Is something that all industries can make use of?
Yes, so the template of the STIR app has been developed for healthcare and social assistance, but that's in terms of the language that's used in some sections of the app. But it can be used within other sectors. For example, I've used it to investigate work-related driving incidents, and currently going to be looking at investigation of heavy vehicle crashes. So that the process, the systems, are very applicable to any industry. The language that's used in the app itself to describe particular elements is for healthcare and social assistance, but absolutely it can be used across other industries.
Thanks, Sharon. Steph, we mentioned earlier the APHIRM Toolkit is very useful for medium to large size businesses. We've got a question coming through here asking whether these apps would be useful for small businesses. This person who's asked the question has 10 in their team. Is this something that would be useful, or is that something that's more targeted to those medium to large size businesses?
Yeah, again, like I said to you about that little glitch that we had around working groups and sizes, and impacting the output data, yes, it might be a bit small. The only thing is, though, I think it's valuable from a resources perspective to look at what the survey questions are as an example, because if you're wanting to consult with your workforce, it's got it's got all of the survey tools you can download in a sheet. So you could sort of incorporate that into a small business forum. For example, when you're talking to your workers about what needs to change or what hazards were present, it might be a nice way of sort of asking, giving you some ideas about questions that you can ask them that will help you identify the hazards that are present. So I don't think it's the algorithm and the outputs might not be available to you, but the resources would be really valuable for small business.
Thanks, Stephanie. Sharon, a similar situation with the STIR app?
Yes, it can be used in investigation of any incident, regardless of the size of the organisation. So the STIR app is designed to review incidents and looking at the flow of events that occurred for an incident and the factors and the relationships that exist under that review of the incident itself. So it's not dependent on, or the outcomes are not dependent on the size of the organisation.
Great, thanks, Sharon. Another one here for you, Stephanie. Does APHIRM make all of the surveys, or does the lead user need to write their own for the system? And how thorough are they if they're coming from a firm?
They're thorough. They're there. You don't need to write anything. They're all written. They're pre-written. So you can either, like I said, do it via a QR code, and then that people just enter their responses and submit. Or alternatively, you can actually download and look at the full survey before you implement it within your organisation, which I would suggest is a good thing to do, because the thing I think a lot of organisations get a little bit concerned about the fact that it's just another survey, and that survey fatigue is a real thing in a lot of organisations. So some organisations have said, look, we may not go down the APHIRM track, but we're actually going to use some of the questions that they've asked we think are really good for us to incorporate into other surveys so people and culture and other surveys that they might use with their workforce. So it's just, again, another valuable resource where you can ask questions, but it's a you don't have to develop your own questions. It's all there.
Perfect. A question coming through in relation to documentation. So as far as supporting documentation, do these apps supply recordable documentation, say in a PDF form that it spits out at the end?
Mm-hmm.
Sharon, we might start with you there.
Yes, it does. So back in the day where we didn't have the STIR app, to create an AXI map was quite a laborious process. So at the end of doing a review, that you'll be able to create a PDF of the accident under investigation. You will be able to download the actions that have been created and look at where they are up to in the system in terms of completion status. That AXA map in particular is quite a convincing document or graphic to actually show senior management in terms of the system of factors that contribute to the incident under review. So it is a valuable resource to have in place when you're trying to argue for systemic change.
Thanks, Sharon. And Steph, what about APHIRM there?
Likewise, it produces PDF. You can export results via PDF so that you've got those available to drop into reports to various stakeholders within your organisation. And it's also, I guess, you know, as you do the risk management teams and you're talking to people about solutions and coming up with solutions to the hazards that are in the workplace, you record those in the APHIRM Toolkit, and you can then export that whole action plan. So you don't have to retype, a safety action plan. It's there. And so, yeah, you can export that and then use that as your implementation document. So it's, valuable, easy to implement. I love the way it's laid out. I mean, it's just simple. So you can incorporate a lot of the stuff that you actually export into a PowerPoint presentation, for example, very, very easily. And they've also developed even some PowerPoint presentation tools that you might slot in some of the results that you've got to senior management.
Great. Steph, I might stick with you. Questions coming through asking in terms of results, and maybe you might have an example of what is the most outstanding results you've found to date using the app within your project. Is there something that comes to mind?
I think Sharon said it before. There's no silver bullet. So we have been very keen to get some high order risk controls out of this project, and we haven't quite got there yet. As you would appreciate, it's the health system, and to get some high order controls put in place, it takes a long time to get capital expenditure approval, particularly at this time. So we've got a few on the cards. To give you an example of one area that has been changed completely, and it was actually in its infancy when we came into this project and has since been completed, and that is a fully automated dishwasher. So there was some old equipment. The dishwasher wasn't working. There was lots of things going wrong with it. There was which resulted in a lot of more repetition, higher forces, lots of fixing and working around. And so as a result, this group said, we need to bite the bullet. We know that these repetition, high force and awkward postures have come up as a problem in APHIRM in the results of our survey. We're already looking at this as a capital expenditure that we're going to need to replace. So let's get something that is actually going to have, reduce or eliminate all of those hazards altogether. And so they were able to do that, and that's been implemented.
Great, thanks.
Pretty cool too. It's even got like a magnetic thing that picks up all the forks and knives and stuff off the trays, so you don't even touch it. There's no touch points. So it's pretty incredible once you start looking and researching the type of equipment that's available to them. They didn't even know that this existed. So it's when they start researching together and looking for items that would reduce harm to them, it's amazing what they can find.
Sounds like I need one of those in my own kitchen, Steph. A question coming through here just in relation to the control measures that you mentioned there briefly. So does APHIRM actually create the control measures for us, and does STIR, and how detailed are they? Steph, we might start with you there.
Yeah, sure. Again, APHIRM has some suggested risk controls. So if this is your hazard, these are the sorts of things that you might want to look at within your organisation and in your work group. So they don't necessarily come up with the controls. That is the beauty about the APHIRM approach. It's participative. So the risk management teams they're the people that are coming up with, if we only did it this way, might make things easier. And then we need to then influence senior management level to say, can we at all change the way in which we've done this forever? Is there a way in which we can implement it so that we don't incorporate hazards into this process again? So it's the people that come up with the risk controls. It's not the APHIRM toolkit. It's the process that encourages them to come up with them.
Thanks,
It
Steph.
provides you with the framework.
Yeah. And Sharon, the STIR app, does it prompt control measures there for people to look at?
Reiterating what Steph has said, it is a process and it is participative, and every organisation and workplace is different. And so it's important to make sure that any of the actions that are created are going to be feasible and practical for implementation. So I showed on the graphic the color coding system where you have the key themes that emerge from the AXI map. Those key themes prompt the user to allocate actions for each particular theme and allocate those who are responsible for enacting those actions. So it's very important for the individuals to be involved in the development of the actions themselves to ensure that whatever action is allocated to particular key stakeholders in the system is going to be feasible and practical for implementation. So it does involve consultation along the way in terms of people accepting those actions, ensuring that they can be put into place. And that's one of the key principles that's underpinning systems thinking. So it's very much, as Steph said, it's a process and it's a framework to help guide users in creating actions capable of systemic change.
It's a great point. Thank you, Sharon. I think we've got time for a couple of more questions before we wrap things up in this morning's webinar session. Steph, a question has come through here. I think you mentioned earlier some research linking psychosocial hazards and manual handling. Could you speak about what psychosocial factors your project has picked up in the health networks?
Yep. Definitely. So most of it relates to lack of job control. So it's a fast-paced environment, and meals have to be served, and so there's a lot of pressure to get meals out at a certain time, and so that was something that really played that these workforces are committed, and they will work harder, faster, quicker to get that meal to that patient. And so they never want to slow down. And sometimes even if you say, if we could just slow down a little, so that's one of them. They really have an internal drive and locus of control to please the patient who's lying in bed waiting for their meal. So that's a hazard that came up a lot. Another one was supervisor support in pockets. So in some areas it was excellent, in other areas it was suffering. And so that was an area that we needed to navigate fairly carefully, particularly given that a number of the different supervisors might have been involved in the risk management teams in coming up with risk controls. So they're the two majors. And the impact, the research that sits behind it is also, it's outlined in some papers on the APHIRM Toolkit. So those psychosocial influences and the model around how that impacts on our bodies physically is outlined in Dr. Jodie Oakman's research. And there's some papers that are available on the APHIRM website that actually will allow you to, and really nice pictures and diagrams that allows you to show the link between if we have this stressor that's making people feel really anxious or horrible in these work environments, then it's going to have an impact on their physical outcomes. And the third one, I guess, that came up was interpersonal relationships. And those going a little bit haywire in some areas.
Perfect. Some great insights there, Steph. And I think that's about all we've got time for in this morning's session. So thank you very much to Professor Sharon Newman and Stephanie Cassidy for joining us this morning and giving us those great insights. We really appreciate you sharing those insights about the two terrific apps and how they can help with your workplace health and safety risk management. Thank you for joining us, Sharon.
Yes, no, thank you for having me.
And Stephanie, thank you.
Thanks again, and thanks everyone.
And we hope you have found this an interesting and informative session. This webinar will be available on WorkSafe's website in the coming weeks for you to watch again. We very much value your opinion on our Health and Safety Month events as well. So shortly, we're going to be sending you an online survey. Please provide your feedback so we can incorporate your suggestions into our program next year. As a benefit, all respondents will be going into the draw to win one of 5 $100 gift cards. And we'll shortly show on screen a list of all the contacts or programs that we've covered off today, including how you can download and use both of the STIR and the APHIRM apps. If you have any requests for further information, we recommend you get in touch. And remember, if there is something you want to discuss, there is the WorkSafe advisory line open from 7:30 to 6:30 Monday to Friday, and the emergency line is open 24 hours a day, 7 days a week. Thanks for joining us in this morning's webinar.